If kids have a vision problem, they don't know what things are supposed to look like. I've seen a lot of children that have been labeled as behind or difficult when in fact they just needed glasses. And this is where we see that intersection between behavioral issues or learning issues and vision. And it's not black and white. In this episode, we're going to be talking a lot about the interplay between vision and learning disorders, why vision issues can look like behavioral or attentional problems, and how you as a parent, or if you're a pediatrician watching or listening in, how you can help spot these red flags earlier and give the child the support they need. A few months ago, this sweet mom brought her adorable 6-year-old child to see me in the eye clinic. And I could tell that the mom was just kind of had it up to here. She said, my son is amazing. He is so smart. He's so intelligent, but he doesn't like to read. He is unfocused in class. The teachers are really having such a hard time with his behavior. He doesn't pay attention to anything. He's distractible. And I don't really know what to do, but we are confident he likely has ADHD and he's getting evaluated for that. But the pediatrician said, well, we've got to check his eyes. I don't really understand why we have to check the eyes, but here we are. And this is something that is so common that I see. And so I do a full eye exam on the child. And guess what? He is actually extremely farsighted, meaning everything is blurry. So when we use the word farsighted, a lot of people think, oh, they can see far away, but not up close. Well, actually, that's kind of not the best terminology. Farsightedness is hyperopia. So with plus power, everything is blurry, up close and far away. And especially things up close require so much extra work to be able to see. I mean, everything is blurry, especially up close. So of course, a kid's gonna have trouble reading and not be attentive if everything is up here, especially even now when they're still living with iPads and computers in schools. That's still an up close device. It is still going to be really blurred for them. And then a kid's not going to engage in their classroom. Their behavior is not going to be great because they're having such a hard time seeing. And that's not to say that this child does not also have ADHD. In fact, the child did end up having ADHD. But this is also why it's so important to get that comprehensive eye exam. So I gave him a pair of glasses, and about a month later, I got a message from the mom in our patient portal saying, he is just almost like a different kid. He still loses focus and attention, and we're still getting him evaluated for ADHD, but his interaction with the teachers, with the coursework, with the school in general is so much better. And this is where we see that intersection between behavioral issues or learning issues and vision. And it's not black and white. Hello, everyone. I am Dr. Rupa Wong. I'm a board-certified pediatric ophthalmologist. I've been taking care of kids for over 18 years. And I'm also a mom of 3 kids, 2 of whom have ADHD. So this is an issue that's very close to my heart because I see it a lot in my clinic, but I also see it a lot here in my home. With all of this experience, I will say the absolute first step for any child that's being considered for a diagnosis of a processing disorder or a learning disorder or learning difference, as I would like to say, a neurotypical versus a neurodivergent kid, if they're being evaluated for neurodivergence, the first step should be a full eye exam. That's not a vision screen. That's not what the pediatrician does where they make you read the eye chart, or even if they have the photo screener, the little machine where they come up close to your child and take a little picture. That's not the same thing. This is a comprehensive eye exam, and that's really important to do as you're figuring out the learning issues, because there's so much overlap and there's a lot of interplay as well. Because I've seen a lot of children that have been labeled as behind or difficult when in fact they just needed glasses. And that's it. My own, one of my family members told me that he was put in special education. He is this brilliant manager, computer scientist, master's, just so off the charts, Ivy League, went to an Ivy League school. And he was put in special ed as a child because he needed glasses. So we really need to be paying attention to the things that we can control very easily with this eye exam. So in this episode, we're going to be talking a lot about the interplay between vision and learning disorders, why vision issues can look like behavioral or attentional problems, and how you as a parent, or if you're a pediatrician watching or listening in, how you can help spot these red flags earlier and give the child the support they need. So let's dive in. So this is something that I think is really important to think about. 80% of learning is visual. That's just the way it is. Now, there's a lot of different support systems in place that can make it less so, especially for people that have issues with vision. But to get those support systems, we need to know what is going on with the vision. But just think about it. Reading, writing, seeing the board, copying notes, looking at your homework. I mean, my kids' homework, it's all on their computers or their iPads. And even the brightness, I can't even see anything because I'm almost 50. If that brightness is not turned all the way up, they're looking at all of these different formats on a daily basis. It is so visual. So of course, it stands to reason that we need to make sure that the visual system is intact and that there is not something going on that we can address if they are being diagnosed or at least investigated for a behavior or learning processing issue. And here's probably the absolute trickiest part is if kids have a vision problem, they don't know what things are supposed to look like. So they're not going to come to you and say, oh, the words are jumping all over the page, or I sometimes get double, or I have eye fatigue and eye strain, or things are blurry up close or blurry over, things look like a funhouse mirror. They're not going to give you these specifics so that you say, oh yes, you might need glasses, or oh yes, you might have strabismus or misalignment of your eyes and have double vision that's causing these issues. They don't know what they're supposed to see. And so then it's really up to us to help them in that journey so that we can figure it out and we can assess and ensure that they've got everything they need to be able to function well in the classroom as well as outside of the classroom. Because think about it, if kids are getting a headache because they really need glasses and they are just constantly on their computers because of all the homework, they've got a headache, they might not even be able to verbalize that it's a headache, but they know they don't feel well. And that can be frustrating. They know that going to school makes them not feel well because they're constantly looking at things up close, which gives them the headache. Therefore, they might not want to go to school anymore, or they might act out. It's all interconnected. And that's why the visual system is so important for us to address first. So one of the most common issues that I see is hyperopia. Like I mentioned in the story about the child with the farsightedness, that's what hyperopia is. It's plus prescription. If you're an adult watching, likely, if you wear glasses or started wearing them when you were young, you might be nearsighted or myopic. That's the more common thing. But usually people that are myopic or nearsighted, we'll talk about them, they kind of know that things are blurry far away. Hyperopia tends to be a little bit more silent. And the reason for this is we can all see when we're young, the lens of our eye can correct a lot of hyperopia. It can fatten up and thicken, and you can focus up to a large amount, up to +8 to +10 diopters when you're young. So you don't necessarily need glasses for small amounts of hyperopia. But the problem is, if it's a high amount, it really causes a lot of strain on the visual system, and it can cause a lot of eye fatigue. It can even precipitate eye crossing. And so kids have to work really hard. They may pass that vision test at the pediatrician's office, but then just like my example of my little sweet 6-year-old patient, they're just working so hard to be able to see that perfect 20/20 that they want to avoid that. It makes their eyes hurt and they can't verbalize it. They don't know the words to say that, but that's what's happening. So there was actually this really large multi-center study. It's called the VIP hip study. And what they found is that uncorrected hyperopia, this uncorrected farsightedness, was actually associated with decreased scores in preschoolers on early literacy. So it's affecting kids' ability to read. Just like I said, but they can't tell you that it's affecting their ability to read. And these were kids with no other vision issues. There was no misalignment of their eyes, nothing else going on, no amblyopia or lazy eye, just this uncorrected hyperopia, which also can be very normal, but it was causing their reading skills to lag behind. So it's something to watch out for. So what about kids that have 20/20 vision? They're fine, right? Well, not necessarily. Again, most of the time, the screens, pediatricians, they're all checking distance vision because it's really actually quite uncommon for kids to have difficulty reading. If you are over 40, 45 years old, if you are like me, we all need reading glasses to see up close. That's called presbyopia. That's a different thing. That's just because we're old. As we get older, our lenses just don't change shape in that same way. So for an adult, when you go into the eye doctor, we always check distance and reading vision. But for kids, typically we just check the distance vision because it's really uncommon to have a reading issue complaint unless there's something that clues us into it. So usually your pediatrician's not going to be checking that. So that's how these kind of diagnoses get missed. But 20/20 vision actually doesn't even give us a full story. It doesn't tell us how well the eyes work together, if there's any misalignment. You could have crossed eyes and have perfect 20/20 vision in each eye. You can have something called convergence insufficiency, even where the eyes are perfectly straight for far away, but when kids and adults try to look up close, the eyes actually wander when they're looking up close. So that's another thing that can happen, and it's very difficult for anyone that's not a pediatric ophthalmologist to be able to make that kind of diagnosis. And this is where things can get a little bit complicated. There's a condition called convergence insufficiency, which is what I was mentioning. Convergence is your ability to look at objects up close. If your eyes cannot converge, most of us, when our eyes converge, they cross in. We look at something up close, our eyes cross in. Convergence insufficiency means that there's a deficit in that. So you should be able to look almost to your nose, looking at your finger. Look, see if you can see your finger touching your nose. If you can do that, even if everything around you is double, your convergence is likely normal. But for a lot of kids and adults, when they are trying to do this, they lose focus. They just cannot touch their finger to their nose and maintain the finger at least to be single because of this insufficiency of the convergence mechanism. And there is a substantial amount of overlap between convergence insufficiency and ADHD. Again, not saying that vision therapy is going to cure the ADHD or cure the learning processing issue. But if we find convergence insufficiency on an eye exam, there are eye exercises. The one time that I recommend eye exercises, you can do it with an optometrist and vision therapy if you want. There are also home exercises that you can do. And these eye exercises have been shown in studies to be helpful for this particular condition of convergence insufficiency. Now, kids with convergence insufficiency also have symptoms that mimic ADHD, because if you can't move your eyes in when you're looking at something up close, what are you going to do? You're going to avoid doing anything up close. You're going to avoid reading. You're not going to pay attention. You're going to lose focus. It might be hard for kids to be able to read all the way across the line because maybe they can start out and control it, but eventually once they've got midway down the page, it's just everything is double up close. So avoiding reading, poor reading fluency, just fidgeting, not being able to focus, those are also can be signs of ADHD. So there's a lot of overlap and one can be diagnosed as the other. And it's really important to kind of decide or determine if the child actually has both, if the child just has one versus another. But a study from 2005 found that kids with ADHD are 3 times more likely to have issues with convergence insufficiency. So that is interesting to know. And just always, it's something that I'm examining to see if that's an issue for the kids that come in to see me. Now, to be absolutely clear, that does not mean that every child with ADHD has a vision problem. My 2 children, perfect 20/20 vision, distance and near, they do not have convergence insufficiency. So that doesn't mean it's always going to be associated with this convergence problem, but it can be. And if that's something we can treat with some exercises, it might make reading more enjoyable, might decrease kids' frustration with reading, and might just improve their attention and focus for this task, which otherwise was really seemingly difficult. So our academy, the American Academy of Ophthalmology, the American Academy of Pediatric, and the American Association of Pediatric Ophthalmology and Strabismus, Our guidelines are that any child that is being diagnosed with a learning issue should have a comprehensive eye exam. And in that comprehensive eye exam, we check for vision at distance, vision up close. We dilate the pupils. We check the retinoscopy. We check the underlying farsightedness, hyperopia, nearsightedness, and astigmatism. So we reduce their ability to compensate for it by paralyzing their focusing muscles. That's what we're doing with the dilation drops. And then we're also checking the alignment of the eye. We're checking to make sure the eyes are straight for distance and up close. The eyes are moving and working well together. Because honestly, the most important thing is that we need to be able to rule out the simple stuff first. If I can prescribe glasses, if I can prescribe some exercises that at least will help. Again, not saying that your child doesn't have ADHD, but it might lower that barrier for them to be able to focus a little bit better. And then this is another thing when a parent comes in and I tell them the vision is good, vision is 20/20. Maybe they aren't coming in thinking their child has a learning difference or a processing issue. The eyes are only one part of the visual system. A very important part is the brain. All those visual connections from the optic nerve radiate to the back of the brain, to the occipital region. And obviously the brain is very important for the processing of this information. So everything can be perfect from a visual standpoint. Perfect 20/20 vision, perfect muscle alignment, everything checks off great from my standpoint. But the way that this information is processed might not be quite the same as for other children. So a lot of times with dyslexia, with the reversal of numbers or letters, sometimes parents are looking to see that it's a vision problem and not a processing problem. And I think I can give them a little bit of reassurance at least. Look, we ruled out this stuff. Everything with the vision is fine. But now we need to investigate the processing aspect. And I know that can be difficult to hear, but we really want to get to the bottom of what is preventing your child from thriving academically and just in their home life to be able to do the things that they want to do. And sometimes that's processing and not vision, because the brain is obviously extremely important in the way that it interprets the visual system, even if all of that is normal. And why are school screenings not enough? And people sometimes will mistake what the pediatrician does and what the school nurse does with what I do. A school screening is just a really quick check, as is the pediatrician's appointment. School screenings are typically limited. I do a lot of free school screenings. I will pay my staff to come in, but usually then that's a really excellent exam that those kids are getting. I've done it through my church as well, where kids are getting free vision screens and we're just using volunteers. So it's not going to be the same as going in for a comprehensive eye exam. Dilating drops are not put in. The alignment of the eyes are not measured. Uncorrected refractive errors, meaning if your child's able to compensate, a lot of times we need to paralyze those focusing muscles to really uncover the true glasses need. And that's not being done at a school screening or even at your pediatricians. They're really just trying to make sure they can check off like the big things. And so sometimes some of the smaller things do get missed. So the comprehensive eye exam, you come in, we will ask your child to read the eye chart. Usually we have a remote system. We don't use the old-fashioned big E anymore. And then we'll ask them to do something up close. I will do what's called cover on cover, where I'm checking to make sure the eyes are straight, even when I cover one eye. Then we'll also put in dilating drops. Those take about 30 minutes to take effect. They are going to make your child light sensitive, and they're going to make it difficult to read up close. Very normal for the entire day. It is not damaging for them to go outside in the sun after they've had the dilating drops, but they just might feel uncomfortable. So it's something to know if they've got like a big baseball game afterwards, they're not going to be playing that great, or you might want to schedule the eye exam for after that. And then once the eyes are dilated, I do a cycloplegic refraction. That's when I am able to assess the true refractive error. If the dilating drops are not placed first, if you go to an eye doctor who just does the glasses prescription without putting the dilating drops, go to someone that puts the drops in first. It is the only way to get an accurate assessment of especially of the hyperopia. There's no other way to get it. And it's very easy to give too strong of a minus prescription if those drops aren't put in first to paralyze the focusing muscles. Then we also use an indirect ophthalmoscope, it's a little headset where I use a special lens, and I'm able to check the retina, the optic nerve, make sure everything inside the eye looks fine and is not inhibiting the vision. Sometimes I see scarring. Sometimes I see that an underdeveloped optic nerve. So there are a lot of different things that can cause vision loss or vision difficulties for a child. And again, they don't know how to explain that. Usually this exam takes about anywhere from 30 minutes to an hour, just because of the time that it takes for the dilation. But it's really important for kids who are being considered for a learning difference evaluation. So, of course, a pair of glasses is not going to fix every single learning issue. It is an easy fix for the most part. So that's why we want to determine if it's the case before going down the route of needing to see an educational therapist and getting the support that you need for the other processing type issues. So here's a list of questions that you can ask the team taking care of your child just to help better understand what's going on. And these are questions that I recommend if your child has a new diagnosis of ADHD or seems to be struggling in school. These are questions initially you can ask your pediatrician, or there's typically a learning support specialist at most schools if they're already plugged into them. Ask them first, does my child need a comprehensive eye exam? And typically they're going to say yes. And make sure that it's not just a vision screen, that it's a full eye exam like I've outlined before with an ophthalmologist or even an optometrist that's going to do all the different steps. And second, ask them, could vision play a role in the types of behaviors that we're seeing for my child? Even if no one's mentioned it, you are allowed to bring it up, and it's really important that you do so. Maybe they haven't even considered it, but it's such an important thing for them to at least think about. Then when you see your pediatric ophthalmologist or your optometrist, you can ask them the following questions about your child's eye exam. Did you check my child's near vision and alignment? So again, a lot of times the near vision's not checked. Make sure they check the near vision. They must do this before the drops are placed because the drops are going to blur the vision up close. So if there's an issue and you're getting evaluated for ADHD, they should know to check distance and near anyway, but double check. Number 2, did you use eye drops to check my child for farsightedness? This is the only way to uncover the full plus prescription that's needed. You've got to have those dilating drops placed in the eye. And third, could any of these vision issues be affecting my child's learning? Now, sometimes your ophthalmologist or optometrist might say, no, everything is fine. Now you really need to go down the route of getting help from a learning support specialist. Or they might say, yep, I discovered convergence insufficiency, or I saw some eye crossing and a pair of farsighted glasses will help with that. Getting your child evaluated for learning differences can feel really overwhelming. And I actually found the whole process to be empowering because something that I had suspected to be true was actually found to be true. And it gave me kind of like a moment of peace to like, oh, this is why that this is difficult for them. But it's really important to make sure that the easy things get fixed. So a really comprehensive eye exam should be the first step. Even if you're doing it simultaneously with the testing to get diagnosed with ADHD or dyslexia or dysgraphia or even dyscalculia, you still want to be able to make sure that you've just ruled everything out. And a lot of times that's what I'm doing. I'm telling everybody everything's perfect. We don't need to worry about this. You can come back and see me if you need. But occasionally we do find things, either this convergence insufficiency or something called accommodative esotropia, where the eyes cross in when they are reading up close and they need a pair of farsighted glasses. So there's a lot of vision issues that can mimic learning or behavioral issues or a combination. We always want to set kids up for success as much as possible. And, since I wear 2 hats here, as a pediatric ophthalmologist and as a mom of kids with learning differences, you're their advocate. So don't feel afraid to ask these questions. And anybody on your healthcare team is going to be happy to answer. Thank you so much for joining me today for In Focus. If you've got questions that you would like answered regarding your child's vision, send us a DM on Instagram at Dr. Rupa Wong, or send me an email at hello@drrupawong.com, or even a voicemail. If you leave that, we can use that. And it's such a great way to highlight something you might be struggling with that others didn't realize they were too. Other parents, once they hear your voice, they say, oh yeah, I was thinking about that for my child as well. That phone number is in the show notes. Until next time, it's good to see you. Bye-bye. Thanks for joining me on In Focus. If you found today's episode helpful, I'd love for you to share it with a friend, leave a review, or hit that subscribe button so you never miss an episode. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.